my final head to toe assessment. Here I have Tracy Quinlan. She is my RNBSN mentor who signed the agreement. She's here to observe and grade my performance. And this is Cassidy Brewer. She's a colleague. She's actually filling in for Selena Baez, my consenting adult who couldn't be with us today. But she is at work, so that's why she's not in shorts and a tank top. And then behind the camera, I have Spencer Wild, who is just recording for us. Do you mind just very quickly, like, showing the room for no notes? There's no notes or cheat sheets or anything. Okay, so we'll just go ahead and get started. So, come in. Hello, how are you?
Good, how are you?
Good. My name is Stephanie. I am a registered nurse, and I'm going to be taking care of you today.
Okay.
What are you here for today?
So I'm just here for a physical, and then I just switched jobs, so converting from step down to ICU, and it's just been a lot, so I just wanted to talk to the doctor about my stress.
Okay. So just from the initial greeting and just general patient survey, general appearance survey, she clearly looks put together. I will ask her orientation questions here in just a second, but her thought process is clear and coherent, logical. She's aware of reality. She's expressed to me why she's here today, and that she's actually got additional concerns that she wants to discuss with her provider. Her appearance looks like she's well kept, like she's clean, like she is just well groomed. When I see her, I'm not concerned for anything like malnutrition or, like if she's homeless or something. So that's just for general survey. And then I'll just ask you a couple questions. So can you just tell me your first and last name?
Selena Baez.
Okay. And what is your date of birth?
12/5/95.
Okay. And where are you today?
I'm at the hospital.
Okay.
UNC Rex.
And what are you here for today?
The physical, yeah.
Okay. So she is alert and oriented ×4 to self, to location, person ×4. Okay. We're just gonna roll with that. Okay. So general appearance, mental. So we've addressed appearance, behavioral. Her level of consciousness is appropriate as well. Like we said, her orientation status is appropriate. Her cognition and her thinking process. We've covered all of that. So I'm just gonna go ahead and dive into the head to toe. So when I'm just looking at her, I'm just gonna look at your scalp, okay? You don't have to have your hair down, but I'm just gonna look through. I'm assessing her scalp. I'm looking for any lesions, for any pests, lice, or anything. Her hair looks very clean, well kept and groomed. I don't see any obvious lesions, no exudate, no anything that would concern me or let me know that it needs to be further investigated. Hair looks clean. When I put pressure on your scalp, do you feel any pain or tenderness?
No.
No headache or anything like that, okay? So that would be considered within normal limits. I'm gonna look at your ears, just looking at the external ear. I don't see any buildup of cerumen or any other drainage. She just has her piercings and nothing else that seems out of norm. I'm gonna just look at your skin real quick, just from head to toe. So I look at her face and she's got an even tone from her face down to her toes, assuming she's short. So do me a favor and extend your arms. Okay, and then turn them out this way for me. Okay, so she's got an even skin tone. I don't see any patchiness, anything that would cause for concern. I do notice you have a scar here. Is that old or is that new?
It's old. I got it when I was a kid.
Okay, so I wouldn't necessarily call this a lesion, but I probably would just jot that down as an old scar from
Falling.
Yeah. Okay.
Yeah.
Okay. I'm gonna assess her temperature with the back of my hand, and to assess if she's hot, cold. She's warm. As she should be. Skin turgor, I'm gonna pinch just right underneath the clavicle. just to assess for hydration and just fluid status at a glance. So when I look at we did head, we did ears. Just since I did ears, I'm gonna just go ahead and jump to cranial nerve number 8. So I'm actually going to just cover her tragus. Do I have it there?
Mhm.
Okay, and then I'm just gonna whisper 6, 7, 8. What did I say?
6, 7, 8.
Okay, I'm gonna go around. Same thing. 6, 7, 8.
6, 7, 8.
Okay, so that's assessing for cranial nerve number 8. Okay, so I'm just gonna look at your eyes now. I'm going to have you just look straight at me, okay? I'm gonna shine a light on your eyes to see if your pupils are reactive to light, and they are. Let's pretend this is a pen. So just look at me and then follow this. Okay, so she accommodates appropriately. Pupils are like this a 4 right now. Reactive to light, they accommodate appropriately. I'll have you look down, look up. Great, now follow just my fingers. So that's the cardinal sign test. So that's assessing cranial nerves 2, 3, 4, and 6, I believe. That's right. 2, 3, 4, and 6. Ocular nerve, assessing upward, downward, lateral movement of the eyes. I'm gonna look at your nose. Do you feel like you have any trouble breathing better from one nostril or the other? Okay, so I'm gonna have you just close one nostril, take a deep breath through your nose. Okay, that sounds patent. Now let that go. Other one, same thing. Okay, so that sounds even. I don't suspect a deviated septum. However, I'm gonna shine a light above I'm just gonna shine a light. I don't see any evidence of a deviated septum. Close your eyes for me. Can you just tell me what you smell?
Alcohol.
Okay, so that, assessing for cranial nerve number 1 for smell. Keep your eyes closed for me. I'm gonna just, have a little swab kind of go around. Let me know if you feel every time I move the swab on your face, say yes if you feel it, okay?
Okay. Yes. 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 Yes.
Okay, great, so that's assessing for cranial nerve number 5. Okay, open your eyes for me. So can you smile? Great, great smile. Puff out your cheeks for me. Okay, that's gonna be cranial nerve number 7. I have a tongue depressor here. Let me actually put some gloves for this on. Okay, so stick your tongue out for me. Okay, so pretend I'm gagging you. Okay, so I'm using the tongue depressor to assess for cranial nerve number 9 and 10, as well as 12. Put this down. I'm gonna press down here and assess your temporal mandibular joint. So let me see if I can get it. Okay, right there. So smile. Okay, now open your mouth big. Awesome, close it. Okay, so I don't feel any crepitus when I assess that. Let me assess your mouth. So we've already smiled. Smile again for me so we can look at your gums. When I look at her gums, her mucosa, they look pink, they look moist. They're not pale, anything concerning for dental disease. Open your mouth real big, stick your tongue out. Yeah, her mucosa in general are just pink and moist. Tongue is pink, and there's no obvious evidence of caries in her mouth either. So we did the smile, we blew up our cheeks. Okay. Okay, so I'm gonna move down to your neck. Okay, so I'm just gonna feel for your lymph nodes, okay? So I'm feeling for the cervical lymph nodes. We have anterior and posterior cervical lymph nodes, submandible. Were you sick recently? Because you have a little bit of a slightly
was.
swollen. You were recently, okay, so it's just slightly swollen here, which is common after any inflammatory process, whether it's allergies or a cold or anything. I'm gonna stand behind you. You can stay right where you are, and I'm gonna feel for your thyroid. Okay, I'm gonna have you swallow real big. Okay, do you feel any tenderness?
No.
Okay, swallow again. Okay, that's perfect. I don't feel any tenderness when I assess her thyroid. Okay, I'm gonna check another cranial nerve, I believe it's 11, so I want you to push up against my resistance. Good, look up, again. Okay, good, super strong. That's cranial nerve 11. Let's see. We did skin. Okay, so I'm just gonna assess her anterior chest now. And I can actually look at her from where I'm standing. I can see her anterior to posterior ratio. It looks even to me. You're breathing symmetrically. Stand up for me real quick. Just step right in front of me. And then I'm just gonna place my hands right here. You just stand normal, and I want you to take a real big breath. Good. She's got even symmetry when she's breathing. While I'm back here, I'm gonna assess her CVA tenderness. So I'll have you turn so the camera can see it. Just right here, right above where the kidneys would be. I'm just gonna give any tenderness when I palpate that.
No.
No?
No.
Okay, great. Okay, you can have a seat. And while we're back, I'm gonna auscultate your posterior lung sounds. Okay, so I'm gonna work my way down in a zigzag-like motion. So just every time I move my stethoscope, you just take a deep breath. I'm gonna assess lateral lung sounds. Okay, every time I move my hand, I want you to say 99, okay?
Mhm.
Go ahead and say 99.
99, 99, 99, 99.
Okay. Now, looking at the front of your chest, we've already established symmetry in the posterior aspect of her chest. I'm gonna auscultate the front. I'm gonna listen to your lung sounds in the front as well in a zigzag-like motion. And then I'm gonna go on and listen to your heart sounds as well, okay? So every time I move it, just in and out. Okay, so her lungs sound clear. I'm not hearing any adventitious lung sounds that would be concerning for pneumonia or COPD or any other acute or chronic process. I'm gonna proceed to listening to her. I'm gonna listen to her heart sounds. I'm gonna look for S1 and S2. After that, I will proceed to locate her PMI, which is usually at the midclavicular, down to the 5th intercostal, and I'll probably have you lay down for that, okay? as well as when I listen to the apical pulse. Okay, so I'm gonna listen from the base of the heart to the apex. Okay, so I hear S1, S2, I don't hear a murmur, I don't hear any extra love dubs, any S3, S4, indicative of standard healthy, probably 5-year-old. Okay, so I'll have you lay back. And I'll just have you kind of tilt yourself a little bit to the left. Okay, and so I'm locating the PMI and I'm gonna actually like palpate for this. And I'm just gonna feel it. We're gonna call it 68 beats per minute. And then I'm going to listen to the apical heartbeat for 1 full minute. And I will use that clock up there. About the minute mark. It's about 68, 69 beats per minute, consistent with the PMI. So you can lay flat on your back now. I'm gonna proceed to, I'm just max inflating this bed so you don't sink in, okay? So assess the interior and posterior part of your chest. Now I'm going to inspect her abdomen. Do you mind just putting your hands on your side? Great, so when I just look at her abdomen, it looks flat, it looks soft, even though I will physically palpate it as well. It doesn't look distended. Have you had any issues with your belly, any tenderness, bloating? No. Okay, so first is inspecting, then I'm actually gonna auscultate all 4 quadrants with my stethoscope and assess for bowel sounds in all 4 quadrants. Got excellent active bowel sounds on all 4 quadrants. So I'm actually gonna have to palpate, okay, and I'm gonna have to do 3 times at 3 different pressure levels, okay? If at any point it hurts, let me know, okay? So I'm gonna just be gentle. From this first round of palpation, it's soft, it's flat, I don't feel any masses, I don't feel anything alarming. I'm gonna go a little bit deeper this time. Still no tenderness? Okay. Okay, still soft, still not distended, and she still reports no tenderness. I'm gonna actually go a little bit deeper now. The intent behind this one is actually gonna be to try to feel your other organs, like your liver, okay? So I'm actually gonna press a little harder, and I'm gonna have you take a deep breath. And I should feel the very base of your liver, which I do, aorta. You okay so far?
Yep.
Okay. Great. So abdomen is appropriate for her age, for a healthy 20-something-year-old. Moving down, looking, I'm just gonna assume I can see your skin, okay? I'm gonna just pull this up a little bit. Her skin matches her upper extremities as well. It's even colored. It's also warm. Skin turgor is appropriate. Checking her capillary refill. It's also less than 3 seconds. I'm gonna check your pulses, okay? So I'm gonna check for her popliteal pulse first bilaterally. Locate those behind the knee. Those are +2s. Then I'm looking for her posterior tibial pulses. That's a +2 on the left. +2 on the right. Her pedal pulses. Also +2s. And then I'm just gonna check your brachials. +2s as well, and your radials. And while we are on pulses, I'm just gonna check your carotid, okay, while you're laying down like this, okay? So I'm just gonna locate one and just assess one side at a time. So I feel your carotid pulse, it's a +2 on your right. I'm checking the one on the left. Also a +2. Trachea is midline. And I'm gonna use my stethoscope to assess for any bruits. So you can just lay, using my diaphragm for that. So she is negative for any bruits. Okay, so let's see. We've done head, we've done face, lip, ears, neck, trachea, swallowing, heart sounds, the interior, chest, posterior chest, abdomen. No issues using the bathroom, right? Are you
No.
pretty regular when you
Yes.
go to the bathroom? Okay, and no problems voiding?
No.
Okay. Alright, skin we've done. We've assessed pulses. We've assessed cranial nerves. What more I forgot? I'm just writing down to make sure I don't forget anything, okay?
Mm-hmm.
To the nose, to the mouth, scalp, head, skin, ears, cranial nerves for eyes, ears, mouth, trachea, lungs, we did chest, CVA tenderness. S1, S2, we did PMI, we did apical pulse, we did radials, brachials, abdomen. Motor, okay, I'm gonna have you sit up. You can come back this way. We're gonna do some like motor strength testing, okay? So I'm gonna just have you pull my fingers. Okay, just assessing just her motor strength. Okay, good. You're really strong. Okay, so I'm gonna have you press down like you're driving. Oh, good. Good, good, good. Now pull up towards you. Okay, awesome. So I'm gonna do a little bit of further neuro exam. So I'm actually gonna have you stand up now, and kind of the same way. Excuse me. When we assess like your kidneys back here, I'm gonna just have you stand here. This is called the Romberg test. Okay. So just stand with your arms on your side. Okay, I'm gonna be holding you just in case. This is just assessing your balance. So I'm just gonna count to 10. Okay, and I just want you to close your eyes. Okay?
Mm-hmm.
And I'm just gonna count to 10. You just stay where you are, okay? Some mild swing. Her drift is normal, but she doesn't seem to have any of that. So I'll just go ahead and count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you can open your eyes. Okay, awesome. If you can just kind of take 3 steps forward. Great. And then turn around. Great. And then walk back, and you can have a seat on the bed. Her gait is appropriate as well, since we didn't initially get to see her gait in the beginning of the video. We're gonna do some rapid hand movements. So I'll have you just sit how you are. I want you to take your heel to your knee, up here like this, and then I want you to slide it down. Awesome. And then the other one, same thing. Awesome. Take your pointer finger, nose to your lips, hands down here, and I want you to go like, if you're playing patty cake, like that, do it like 5, 10 times. Okay, good. So that's assessing for neurological rapid movement. Let's see. Gotta cover all my bases.
Yep.
Assess motor, strain, neuro, your spine. Okay, so I'll just have you kind of lean forward, like, just kind of like a curve, perform like a curve for me. So I'm looking at her spine, and I want to see kind of like just a C shape, which is exactly what I see. I don't see any evidence of scoliosis, kyphosis, anything that would alert me to notify the provider about. Let's see. As far as the back goes, I think I've covered everything. Okay, do you have any questions for me?
I do not.
Okay, well, the doctor will be in for his assessment, and then I'll let him know that we talked about your concerns, okay?
Okay, thank you so much.
Thank you.